often when couples come in, they don't know to cite their trauma experiences, and they actually also don't always know to cite the stress that they're currently under. So what you will hear is people will come in and they'll say, we are here because we are arguing all the time and we don't have sex anymore. I don't know what happened. We had a great relationship, but I hate this person now. I think we should get a divorce. They're a jerk. We're always yelling at each other. We're never talking to each other, whatever it is. But they don't know to necessarily say, we're really, really, really concerned about the economy. They might slip it in there. You have to know to ask. So you have to know to be able to bring it up on your own. Because again, when people come to couples therapy, they're kind of focused on these very like couple specific things. And your job is to kind of help connect the dots around, yes, you are fighting a lot and I want to help you develop some communication skills. And I'm also wondering if we could look at what's underneath all of this. And as trauma professionals, I'm sure you're already very aware of this and doing this and very thoughtful about all of this. So there's a lot of different types of stressors. Some of the stressors that come up in sessions that, again, you might have to know to kind of engage people on in modern partnered relationships are what I call a change in the template of what they think a relationship should look like. And this can lead to mental and physical load disparities and burdens. So what that means is that you'll have a lot of couples who come in and they will say, very, very common right now, especially with that 18 to 34 demographic, they will say, we have an equitable relationship on paper. We both believe in it. I support, if I'm thinking about like a hetero cis couple, like the guy might say, I totally support her and her success and work. And I love that about her. And, she might say, I don't want to be at home doing all the home stuff. And I'm like totally fine with how our life is run. And then as you start to talk, they're arguing a lot about what each person is responsible for. And so there's these mental load disparities, like they've never talked about it, maybe before they had kids. Usually the woman has just taken it on, is doing all of the work in the home, and also working outside of the home. And then on the other end, there is a partner who feels like, because what we're seeing is more and more women are making more money than the men. You have another partner who's saying, I'm so proud of them, but like internally, they're having a lot of kind of internal tension about like what that means about them as a partner and a provider and all of these types of things. But they will not say it out loud because it feels shameful and it's not what they consciously believe, but it might be what they have internalized. And so there tends to be a lot of distress that's not really talked about. There might be if I'm thinking about a couple that I've recently worked with, they both work, she makes more money, and he does more in the home. And again, consciously, they're saying this actually works for us. We're really proud of ourselves for this. This is the type of relationship we want. And when we got down to it, the wife has a lot of kind of internal distress about how she is not there for her child in the way her mother was there for her. And so even though there's been like a conscious decision making around like, this is actually okay for our family and our child is happy and healthy and I'm proud of my work, I also feel distressed because something doesn't feel right. I observed something different growing up and I'm wondering if it's okay what I'm doing now. And what that would cause her is even more stress because then she would take on more than she could actually do.